Calling the informational briefing for November 21, 2024, Committee on Health and Human Services. Present with me is Chair of House, Representative Lisa Martin, Chair of Human Services, myself, Chair of Health and Human Services for the Senate, and present also on Zoom will be a participant. That would be Malama Ohana, Venus Medeiros. This informational briefing aims to address the April 2024 audit and concerns regarding foster care by Child Welfare Services. There will be a focus on recommendations from the Malama Ohana Working Group's data, which has been substantial and ongoing, and we really thank you for all that hard work, as well as the audit of CWS by our auditor, Les Kondo, the 2016 East Hawaii pilot program's findings, and any improvements by DHS to increase recruitment of foster families and social workers. The goal is to develop strategies to enhance support, improve recruitment, and strengthen the CWS's systems effectiveness. I want to point out that there is an error in the announcement in that we inadvertently included parents and children together, and they are not part of this informational briefing. So an amended agenda removed their presence. So present that will be presenting today will be State Auditor Les Kondo, Department of Human Services Director Ryan Yamane, and Deputy Director Tricia Spear, Director of Child Welfare Services Daisy Hartsfield, Administrator Eladine Olivayo of CWS Brand Administrator, Malama Ohana Working Group, and that was Venus by Medeiros, present on Zoom. And we also have Office of Wellness and Resiliency Director Tia Hartsock. And we will begin today with Les Kondo. Auditor, please proceed.
Thank you. Good morning. I'm Les Kondo. I'm the State Auditor.
Please put the microphone closer to you. I want members and presenters to be aware that we have a number of people who are watching us on Zoom. And so we want to make sure that, so also present is Senate Chair of Commerce and Consumer Affairs. That one is also locked. Please unlock the doors. Okay, is that I thought we unlocked all the doors. Is Jared Kiohokolole. So I want members and presenters to be aware that we have a number of people who have expressed huge interest in this and will be watching the streaming on YouTube. So we need to be mindful of their time. We have allowed for 15 minutes presentation for the presenters. There will be a substantial amount of leeway for questions and answers. Questions are only going to become from legislators who are present, okay? And also we have Vice Chair of Health and Human Services and Chair of Labor, Henry Aquino is also present. And if you'd like to pass out your audits to Chair Aquino and Chair Kiohokolole, would you like to have a copy of the audit? Sure. Okay. And okay, so because we want to be mindful of everybody's time, we want you to be efficient. So please proceed, Auditor Kondo.
I don't think efficient is what I'm known for. But anyway, thank you very much. Good morning. My name is Les Kondo. I'm the State Auditor. We issued this report in April, so I appreciate the committee's having a briefing on our findings. I think our work is extremely valuable to the legislature. We provide insight as to how programs that you folks stand up and you folks fund, how they're performing. We also provide, to some degree, some transparency into programs that perhaps you and the public may not be able to see. So I feel like it's very important. Our work is important. I feel like it's important to have these briefings, so thank you very much. I guess I'm going to talk about the audit. I'm going to talk about how we went about and how we came to our findings. If I go too long, please cut me off. But the impetus for our audit was Senate Concurrent Resolution 102, which I think Representative Martin was the drafter of, and we appreciate the fact that it did get through and we were going to do an audit of Child Welfare Services Branch. Initially, there was some concern about our ability to audit Child Welfare Services Branch, partly because of the federal oversight by the Children's Bureau. And I think my office in the past had taken the position that perhaps we should not audit Child Welfare Services Branch because we did not want to interfere with or perhaps step on the toes or get in front of or get in the way of what the federal oversight was doing. I didn't feel like that was, I felt like we could carve out areas that we could audit. So as part of our process, we go through a planning process. We try to understand what the department does or what the program, how the program operates. So that process took 3 months or so. We looked at intake, or placement, how they intake calls, how they screen calls. We looked at licensing, and we looked at their casework or placement work. Placement work, casework, that was the area where I think there was federal oversight. So partly we chose because of that not to look at casework. We looked at licensing, and the reason for that also was because when we talked to the CWSB administrator, she told us that licensing was the area that had the most risk. And because of that's one of the factors that we certainly consider, looking at areas with risk so that we can try to identify ways to eliminate the risk. So this is what the administrator told us that this licensing area was the most risk. That's what we chose to audit. Our objectives for the audit were this is right out of our report. We're looking to first, initially, we thought we would look at the process that Child Welfare Services Branch undertakes to do licensing. That's generally what we do for performance audit. We look at the process, we see where the process might be improved. But in the case of Child Welfare Services Branch, they have outsourced a substantial part, almost all of the licensing function. They've contracted, at the time that we did the audit, it was Catholic Charities. They had contracted with Catholic Charities to do the licensing work. We do not audit private organizations. We don't have that authority. We don't have the ability to go in and look at the private organization's process. So instead, we turned this audit, the first objective, we turned it into what I would call a compliance audit. We wanted to assess whether or not the branch was complying with the statutory requirements for licensing, meeting the statutory deadlines, both in the law as well as in the administrative rules, the deadlines to issue licenses or how long provisional licenses could be issued. Because we didn't have the ability to look at Catholic Charities, that doesn't mean the department or the branch doesn't have that ability to monitor Catholic Charities, to oversee its work, to assess Catholic Charities' performance of the contract. The second objective related to that aspect. We wanted to see what the department was doing with respect to those contracts, how the department was monitoring and overseeing those contracts. So those were the two objectives for this audit. So for the first, or what did we find? These are our findings. So we found that the licensing of foster homes didn't comply often with the statutory requirements. It created risk that foster kids were in homes that were not safe, healthy, and nurturing environments. We also found that the department, DHS, that they were reimbursing contractors personnel and administrative costs without assessing whether the contractor was achieving the performance that they were contracted to do. Those were our findings. I'm going to talk about each of them in a little more detail. The first finding, licensing of foster homes often did not comply with legal requirements. What we did, or let me take a step back. Actually, let me take 2 steps back. I want to say initially that we got great cooperation from the branch and people that we spoke to for purposes of the audit. So we appreciate the cooperation, starting with the administrator, Social Service Division, Child Welfare Services Branch Administrator, the administrators of the different sections under the Social Service Division. We had the cooperation that we expect. We didn't have trouble getting information generally, so I wanted to express my appreciation to the department or to the people that were involved in the audit. The second thing is, my second step back is, this is, DHS's governing statute, Chapter 346. So they have an extremely challenging job, important job. They basically protect our vulnerable keiki. And I wanted to start here because this is our touchstone for this audit. It was to ensure that whatever CWSB was doing was to make paramount the safety and health of children who have been harmed or are in life circumstances that threaten harm. That's what the statute says. That's what really, you know, their primary mission to me is, at least with respect to Child Welfare Services Branch. And in fact, that's reflected in their administrative rules. So DHS, or Child Welfare Services Branch, has promulgated administrative rules to provide greater detail to how they perform licensing. This is the first section of the administrative rules. The goal is to keep children, puts children in a safe, stable, and nurturing environment. So I think that's really important for all of us to kind of remember as we go through our findings. That's the ultimate goal, is to make sure kids are in a safe, nurturing environment. So all foster homes need to have a license or a certificate to be able to care for foster children. Black and white in the statute, must have a certificate of approval in order to care for children. And in fact, it's such an important requirement that there's a penalty provision in the administrative rules, $200 fine if you care for children without their certificate of approval. There are two kinds of homes that Child Welfare Services Branch oversees. Two types of foster homes, resource care homes. I call them foster homes, but in the statute they're called resource care homes. There are two types. One is a general licensed home, and a general licensed home cares for any types of foster kids. In other words, there's no relationship, pre-existing relationship between the child and the caregivers or the foster home. The other type of foster home that Child Welfare Services Branch administers or oversees are what are called child-specific homes. And those homes have, or the caretakers or caregivers for those homes, they have a pre-existing relationship with the child. Maybe it's a relative, maybe it's a friend, maybe a friend of the parents, maybe it's a teacher or somebody that has a relationship with the family or the child. So as of September 8, 2023, these were the number of foster homes in the state of Hawaii. 993, child-specific homes 585, and general license homes 408. And it's a breakdown by island, total foster homes as well as child-specific and general license homes. This is a graphic that's in our report. I included this just because there is a definition in the administrative rules about a certificate of approval. That's what a license is. That's what's required to be able to foster children. But because there are times when child-specific homes, in other words, when a child that has a relationship with the home that child is going to get placed in, they don't have the time to be able to complete all of the licensing requirements. The administrative rules, DHS, by policy, has established what they call a provisional certificate of approval. It's a temporary license. It's intended really, in my opinion, to bridge the time between when the child is placed in the home and for the home to be able to complete all of the necessary licensing requirements. But specifically, by policy, the department, in their administrative rules, has limited the time of that provisional license to 60 days. I would suspect that's probably reflecting a policy balance between the risk to the child to be in a home that is not fully licensed, and also balancing the need to have a roof over a child's head. I think the department, when they promulgated the administrative rules, they determined that the reasonable balance was 60 days for the home to complete the licensing requirement. So this is another section of the administrative rules about how the licenses are issued. It again talks about a provisional certificate of approval not to exceed 60 days. Not to exceed 60 days. In fact, DHS, or Child Welfare Services Branch, also has a policy manual, and this is a snippet out of their policy manual for licensing, and it again reflects the department's policy to get these child-specific homes into an unconditional license as soon as possible. It even talks about the inability for the department to receive federal reimbursement, Title IV-E reimbursement for children, foster care payments for children who are not in an unconditionally licensed home. In other words, the department cannot get federal reimbursement of those costs or those expenditures for children who are only in a provisionally licensed home. And the rules also, the policy manual also reflects the 60-day limit. It says that if a resource family has not met the requirements by the time the provisional license expires, the child must be removed and the house and the home closed. There are certain exceptions, but the exceptions under the policy, under the procedures, they're very limited, very limited. I put up the slide because these are the differences between what's required for a provisional license or provisional certificate of approval and an unconditional license. So on the right, those are the things that are not required for a provisional certificate of approval, a temporary license. And the big ones are the FBI clearance. It's a fingerprint-based background check that is run through the FBI database. That is not required for a provisional certificate of approval. Another thing that's not required for a provisional certificate of approval is a home study. Home study involves interviews with all of the occupants of the house, adults as well as children, and makes recommendations as to the ability for the caregivers to actually provide foster care for the children or the child. Hanai training, another important thing that's not necessary for a provisional certificate, but this was just trying to illustrate what is needed for an unconditional license, which is all of the things on the right as well as all the things on the left, but also trying to illustrate what is not needed for a provisional certificate. So provisional certificate, temporary bridge, it does not check off all of the boxes the department has determined is necessary to ensure the home is a safe, nurturing, and healthy environment. Those are the things that are required for the unconditional licensure. So we found, as we looked at what they were actually doing, we found that they had greatly expanded their ability to issue not only the provisional certificates, but to continue to have children living in homes much longer than 60 days. So what happened is, through an internal communication form, ICF, that was issued effective in August of 2019, the department expanded the 60-day time limit for a provisional certificate, which is in the law. It's in the administrative rules. Administrative rules have the force and effect of law. They expanded it by an ICF, which is in essence an internal memorandum. They expanded the time of the provisional license to 90 days. 90 days, but they also said, again reflecting the procedures in their procedure manual, that if the home is not able to complete the unconditional licensing requirements within that 90-day period, the child should be removed. And the child should be placed in another home where that family can meet the unconditional licensing requirements. There are two exceptions in the ICF that would allow the issuance of one 60-day extension. That's not allowed in the rules or the statute, but it's allowed through this internal memorandum. One 60-day extension. So 90 plus 60, 150 days. So even with the extension, the maximum amount of time a child should be in a home that is only provisionally certificated is 150 days. The exceptions that allow the one additional 60-day extension, very limited. Sudden death in the child-specific applicant's home, and adult household member is immobilized and not able to go get his fingerprint for the FBI background check. Those are the two exceptions that allow the department, under the ICF, under the internal communication form, to extend the license. This ICF was later rescinded, but the 90 days continues to be in effect through a different ICF. And again, it repeats what it said earlier. Even after the extension, the 150 days, if the home cannot complete the unconditional licensing requirement, the child is supposed to be removed and placed in a different home. The 90-day requirement that is reflected in the ICF, it's not something that's hidden from the resource caregiver, the foster parents. So this is a snippet from the very top of the resource caregiver licensing application, specifically saying that all requirements must be completed within 90 days. On the agreement between the caregiver and DHS, it specifically says, and the caregiver signs the agreement, specifically says that the caregiver is representing that they shall complete all of the licensing requirements within 90 days. And it even cites the administrative rule that requires that, cites the law that requires that. So what we did is we did a sampling of the 900, initially we were told there were over 1,000 files, but after we went through and we eliminated duplicate files, there were 993, I think the number is, total files of active homes that the department told us had a child or children that were in those homes, both general license homes as well as child-specific homes. So we took a sample of about 10%, 103 homes, 59, random sample. Out of the 103, 59 were child-specific homes, 44 general license homes. And out of the 59 child-specific homes, there was insufficient data for us to do any analysis on 6 of them, and we determined that 4 others had been closed before they were licensed. So we eliminated those 10. I'm sorry?
Les, we need you to wrap up so that we can hear the DHS's. There will be questions and answer questions after.
And we read it.
Okay.
Yeah, so rest assured we read it.
Okay. Well, I mean, really, I'm just showing you the
Yes.
evidence, so to speak, and if you don't want that, then that's okay. I can just answer questions. It's stuff that we didn't reproduce necessarily in our report, but I thought. Okay, that's fine.
We're not telling you to shut up right now,
No,
but we
that's
just
okay.
need you to wrap up.
Okay, anyway, I just wanted to talk about what we saw. We saw, I was mentioning that, sorry, I'm going the wrong way. We saw we saw that out of the sample that we looked at, none of the homes got licensed within 60 days. 3 of the homes got licensed within 90 days. Many had been unlicensed, provisionally licensed for over a year. The difference between a provisional license and an unconditional license, which is very important, is that an unconditional license needs to be renewed every year. Provisional certificates, the way the department was handling them, they were just extending them. So there was no further assessment of criminal background check. There was no CAN registry, that stands for Child Abuse and Neglect Registry and National Registry. There was no further checks of that with the provisional certificates that were just extended. And these were extended, like I said, some of them for over a year, sometimes even more than a year. So we confirm our findings through the OIT report, which is the Office of Information Technology report. DHS uses that, or Child Welfare uses that to track their status of license. This is a snippet from it. On average, they were overdue 274.4 days. This was a letter, it's also in our report, that really illustrates some of these points about how the provisional licenses were issued again and again, retroactive 4 times, 7 total, granted the extension even though they were missing a lot of required documents for licensure. And at the end of the day, 12 days later, the 3 of the 4 kids, 1 kid had aged out, the 3 other kids were removed from the house because of allegations of sexual misconduct or sexual abuse. Why does it matter? It's because it's about the kids, and it's about keeping the kids in a safe, healthy, and nurturing environment. And without the licensing being finished, DHS doesn't know whether the home is safe, healthy, and nurturing. The other part I think that's important is, and it's really a secondary part because it's the safety of the kids that's paramount, it's really the inability to collect or recover the federal funds from the Title 4E funds. Reimbursing contractor costs without any kind of oversight of the contract. I don't need to go over it item by item, but the contract clearly provides that the services are supposed to be provided, expedite licensing. There are performance measures, 90 days, 100% of all homes within 90 days. And based upon our report, really that number that is done within 90 days is probably close to 0.
Okay, thank you, Les.
All right.
We all care about the kids. That's the reason for the informational briefing, yeah.
Happy to answer questions.
Yes, and that's why you're here. Okay, DHS, we need you to respond before, but stick around, we may have questions.
Yeah,
Okay.
let me stop sharing. Yeah.
Okay, so Director Yamane and Daisy Hartsfield. Okay.
No, you say it. I don't
Okay.
want the next.
It's okay, it's okay, it's okay.
Hello,
So,
Chair.
okay,
Yeah.
so Chair Yamane, you know the need for the
Yeah, microphone.
microphone because you're on YouTube here. There's
Oh,
an extra
okay.
microphone, one for you. You saw the audit, we saw your response, but as you heard, it sounds like you folks keep papering over the lack of licensing, right? So what's your response?
Okay, so before we address those specific items, again, we would like to thank you for calling the for brief. We appreciate the auditors and we understand the intent of what the audit is to do. We at the department take the audit seriously. We actually have met several times over it, and later on in our presentation, we will go over some planning objectives that we look forward that includes not only what the auditor report indicated, but also our partnership with the Attorney General's office and the recommendations from the Malama Ohana working group. But before I turn it over to Daisy Hartsfield, our administrator, do want you to know that we are looking at all the action items and findings that Mr. Kondo has presented. We put it in categories in regards to addressing some of our biggest needs, which include stuff like staffing, training, policy procedures review, which we'll go into detail later. But I will turn it over to Daisy to specifically respond to your
Okay, so I want to make sure that people know that DHS has an opportunity at the very end to do another presentation, but so that we are able to respond to the auditor's audit, we requested DHS to do a short response specifically to the auditor's audit, then we do the Malama Ohana working group recommendations. So please proceed.
Thank you, Chair. And again, I want to extend the mahalo shared by Director Yamane, especially to Auditor Kondo's staff, who was very accommodating in terms of meeting with us during trying to gather information and trying to understand how our processes work. So first, I just wanted to just add some additional information, and that has to do with the child-specific home. So that's also known as our relative placements. So I wanted to make that distinction. And candidly, we were not taken by surprise with the recommendations and the findings of the audit. And we have taken some steps to try and address it, but it will be a long-term corrective action plan that we're implementing in order to address all of the recommendations. That being said, I did want to share with this committee that we currently do not have a contract in regards to licensing. We're in the process of drafting a new contract that is being reviewed by the Department of the Attorney General's, and we took into consideration the recommendations by the audit to kind of incorporate that into a contract that we hope will address the concerns that was brought to everyone's attention from the audit. And then we also have we've implemented an additional type of data system to try and pay closer monitoring as to the timeliness of the certification. So we do have a contracted provider, it's called Binti, that collects data, and we have made that shift internally that we are looking at the 60-day deadline as provided in the rules versus what was a common practice of 90 days. So that has been a shift that the branch has taken to make sure that we meet that timeline. And if not, then we need to look at the appropriateness of the placement. And then I also wanted to make that distinction between licensing and placement. DHS does have authority in regards to licensing. When it comes to placement, though, it is a system type of decision that's made, that's not solely made by the department. That's something that family court, as well as the other parties in the case, have a say in as well. So I just wanted to make that slight distinction. So for licensing, the department is working with the Office of the Attorney General so that we can address all of the recommendations and be in compliance with what is required by the rules, statutes, and we want to work towards the same goal. And our staff was encouraged to be as candid as possible because we do want to improve the work we do and better serve our children. And so we're hoping that the steps that we've implemented based on the recommendations will attain that goal.
Okay, questions? Okay, Brett Martin?
I do have questions.
Yeah, I do have questions too, but Brett Martin, go
If you
ahead.
want to go first, you can.
No, it's okay, I'm chair, so I'm supposed to be the end.
Okay. So first of all, I appreciate the audit. I had no idea what would come out of it. And this isn't exactly what I expected, but I think it is really useful. So I really appreciate that you went through that process and you found something concrete that you could look at. I did meet with Catholic Charities to understand, their point of view. And one thing I learned there that surprised me that wasn't part of this audit report is that they often didn't get the cases referred to them until after, I think on average, depending on the island, 28 days to 110 days. So that time had already elapsed, right? The clock starts ticking when the child is placed. It's not even assigned to the contractor until well into this 60-day or past this 60-day period. So that's something that the department can control. So I guess my first question is, why is there that lag in referral?
If I may call on the branch administrator, she probably has details.
So that would be Eladine?
That would be Eladine Olival.
Oliva. Okay, so Eladine Oliva. So, yeah, you might need to move over here less.
Good morning.
Good morning.
Eladine Olival. I'm the Child Welfare Services Branch Administrator. Again, thank you for this opportunity to share about the concerns that have been raised for the audit. And the question, if I heard it correctly, was why is it taking so long for the department to pass on the paperwork to the contracted provider? And there's a couple of different things that we understand that's happened. The biggest thing is the paperwork, the process to do the paperwork. There's certain things that need to be complied with, which requires our engagement of the family that we've placed children with. Oftentimes, we're chasing them to come in to do their background checks. We're asking them to do their TB checks. They're also working families. And so the biggest obstacle has been just getting through the necessary paperwork to gather all of those documents and to be able to forward them to the contracted provider. So that's been the biggest barrier. It's just that process and that gathering of the paperwork.
Can I ask a follow-up question?
Okay. Yes.
So that's confusing to me because I thought that's what the Catholic Charities was supposed to do. They're supposed to do the TB check. They're supposed to interview all the household members. They're supposed to do the background checks or get the paperwork into the agency like the FBI or wherever to do the background checks. So it's confusing. You have to do it first and then you send it to them to repeat it?
There's paperwork on our part that needs to be completed as well. Also, when we do a preliminary, when we go and we're placing, especially in our child-specific homes, we have to do a CAN clearance. We have to do a criminal history check. We go out and we have to do a preliminary home study. It might not be the full-blown home study, but we have to go and verify that there's a home, and that the home is safe. We have to do criminal checks and CAN checks on every household member that's in that home. And that's all the preliminary checks that we are required to do. And not always are those members of the family available for us to process the paperwork.
Okay, so I have questions and then we can go back and forth.
It sounds like that is a redundant, like you're doing basically what you're turning around to then ask them to do, and they're waiting a very long time to get started.
Sure.
Can it be combined so that things are done once? That would be my question that we can talk about later.
Okay.
Yeah, Representative, so we are actually in the process of creating a new contract. That contract that existed at the time of the audit, it's since it's done. That contract is over. So we currently don't have a contracted provider doing the licensing at this point in time.
Okay. Okay, so thank you. So it sounded like the whole licensing and the lack of licensing, it sounds very administrative, but the reality is, as pointed out by Les Kondo, when you don't have the licenses, you don't have the criminal background checks, you don't have the health requirement back checks, you don't have the employment history checks, you don't have the home study, and from what I've heard, we only have had one nonprofit who actually sent in an application for an RFP for the licensing. So what is the department going to do to increase the pool of applicants so that we will have the kinds of checks and balances? I mean, $2 million sounds like a lot of money, but apparently it wasn't enough for other nonprofits to step in to do what is necessary for the certificates and the licensing requirements.
To clarify, when a home does not have its certificate, that means all of what is necessary has yet to be verified. So there might be CAN clearance that's completed, there might be TB tests, but it's missing the criminal history, check background. So I just wanted to clear that part up. In terms of what we can do to recruit, we've done some public service announcements. Every time we go out into the community, we encourage people to consider being resource caregivers. So it's a matter of going out into the community and educating them about the need. But for our special licensed families, those are our relative caregivers. It's a matter of making sure we closely monitor them so that they can timely meet the requirements. Sometimes language is a barrier, that's part of the delay, but I will acknowledge that we could do better follow-up to say, look, we're at the 15-day mark and we're still missing these items. We need to get these done. Please continue to do so. So it's been a bandwidth issue to try and address that, but because of the audit administration, met with their staff and said, look, we need to do better monitoring, and so, their licensing staff did a review of the cases and took a look at what cases have yet to be licensed so that they could follow up and monitor those cases more closely so that we didn't fall into the situation that was identified by the audit.
Okay, so yes, Director Yamane, because I don't believe you answered my question.
So let me address your question. So we are taking a strong stance on looking at the process currently. We are looking at how the RFP was written, and we are looking at how to incorporate some of the feedback that we're getting from the community as well as the auditor and the AGs, and then we will be crafting a new RFP to go out, and we're hoping to partner with some vendor. If that's unsuccessful, since vendors are now in the community are challenged in a number of ways, not only these vendors, but vendors in general in this area of human services, we will need to look at what the cost impacts would be, the implications of if they're able to serve every island. So we are looking at that currently on trying to plan that out for the next RFP.
Okay, because currently, right now, after the audit, it seems to me the only vendor, which is Catholic Charities, basically gave up. And you don't happen to have a vendor who is going to help out with monitoring the certificates, like Rep. Martin was pointing out, to make sure that they comply with the background checks, the health requirements, employment, the home study? I mean, you don't have a vendor right now.
Currently, I'm unaware of any vendor available.
So who is doing it?
We
That's correct. Binti is collecting the data that we rely on, and then we have our,
The database.
correct, and then we have our licensing staff.
Currently, it's being absorbed by the child welfare staff. I did want to mention that we also are building our new CWIS system, our child welfare information system. We have made and asked to make our licensing portal, our licensing piece a priority in that, and that system will be able to do what our current system is unable to do, which is help us to track, to monitor, to be able to do real life,
Real time.
real-time dashboards, so that right now we do those things manually. The OIT report that was referred to, those are, we rely on those report come, we look, we circle, we write dates. This new system, and I know it's maybe 2 years out, but that system will be a game changer for us to be able to track real time.
When do you expect that system to be up and running?
2 years, yes. But right now, everything's tracked manually.
Okay,
For
so
us.
in 2 years, we're not gonna be able to satisfy the auditor's concerns.
So, Chair, when we go over our part of
Your
our
portion,
presentation,
okay.
we will tell you some of our
you
short-term,
hope.
mid-term, long-term objectives. So that way, within the 2 years, we have identified goals that we are working on. However, we have not, since the audit report has come out, we as a department have immediately made investments into the division. They've been working on not only addressing things like where the new trainings would be. We're actually working on development of groups to address rules, policies, and procedures, which we'll go over. We've actually are looking at filling those key vacancies, and we actually assign individuals there to address that specifically, to assist the division on moving forward on that, as well as we have been putting some other fiscal measures within the department that will then be shared also with the division.
You know, prior to the auditor's, I'm sorry.
No, it's okay. I have a question when it's
Okay,
appropriate.
let me
When it's
let me
appropriate.
do a follow. Prior to the auditor's report, and I know Director Yamane, you're new, okay? It was Director Betts before, but we have, was there any monitoring of Catholic Charities to make sure that they were following through with the licensing and making sure that the background checks were being done of those who are in either child-specific homes or general homes?
Chair, if I could respond, it had already been identified that this was a contract that there was some concern because the number of licensed homes was not what was projected. And so internally, we were already taking a look at that contract to see what needed to be addressed. So we were aware that there were some concerns in regards to the contract. And I'm saying it's not the contractor's fault because, again, as the branch administrator explained, the delay was, the paperwork and for them to receive the referral. So we were already taking a look as to why the anticipated numbers were not being attained. So some of the things that were identified in the audit, we had already identified internally.
I have more questions, but Senator Kiyoko-Lola, do you have any? Rep. Martin, go ahead.
Okay.
Oh, excuse me,
Senator
Senator Aquino? Okay, Rep. Martin.
So it seems to me like the fact that the provisional certificates just keep getting extended means neither the department nor the contractor ever had any stick to people kept the kid, assuming they want to keep the child, and they kept getting paid, assuming they want to keep getting paid.
$2 million.
So there was no, I don't mean the contractor, I mean the individual monthly payments, right? And so I don't blame the contractor, to be honest, right? They're getting the referral very late, and they have nothing to work with if families choose not to comply, because everybody knows you folks will just keep giving a new contract or provisional one, or not even extending it, like just letting them keep the kid and keep paying them, and then going back later and retroactively extending it. So I feel like you folks are taking away your own assets in trying to get families to comply.
Do you have a question?
So what can you do about that, is my question. Have you revised your strategy, your policy to change that so that you actually have a way to get family members to comply?
I'll respond, and then Ms. Olival can add. So again, placement is an issue where it's not just the department making the decision. There are review hearings before the courts, and the courts are aware of the licensing status of where a child is placed in. As a result of this audit, we did look internally and we said, look, we have to follow what the rules say. And so if a family does not meet that compliance, and if the court decides that placement needs to be changed, because we do need to get approval before we change placements as well. Once a case is involved in family court, any changes parents can disagree with, and they can have the court decide what is the best placement option for a child. But that being said, the department has to look at different placement options, because if a family cannot comply and meet the licensing requirements, then we agree that there could be a safety risk involved, and we want to be consistent with our rules as well. And so that's been the message that we've been sending to our staff, to get those homes licensed and to encourage and to monitor these families, these RCG families closely, so that they can get a general license versus the prior practice of continuing a provisional license.
Okay, so my follow-up basically is, you folks have a very difficult job, and I understand that, okay? And that's the reason why in 2022 we tried to give you folks a lot of money, $10 million to hopefully. And it was just a shot in the dark, frankly, because we did not know how much it would cost to fix this problem. But it was a one-time shot. How much of that money was used to do this database? And because you kind of already knew where Les Condo was going to come in, to beef up the licensing, to make sure that certifications, provisional certifications were going through, to help the child-specific homes meet those licensing requirements. Was any of that money used so that it gets better, hopefully, less than 2 years?
Yeah, you want to answer? Okay. I don't have the exact amounts, Senator, but we did use the monies to try and increase the amount of the contracts. As you all are aware, many of our contracted providers were struggling given the amounts of the contracts. So some of that money was used to try and increase the value of the contracts. The reality was that many of the service providers were unable to build their capacity with those monies, and so not
Why?
all of them, they could not find qualified people to apply for their positions. So, and that's still, yeah.
Okay, so that'll be in the DHS presentation portion. Okay. Do we have any other questions regarding the audit and DHS response to the audit? Because then we'll have Malama Ohana next. Thank you.
Thank you.
And thank you, Les Kondo and the auditor staff for your work. So Malama Ohana, Venus, and we have Tia Hartsock of Office of Wellness. Whichever one wants to start first. Venus, why don't you go start? Tell us what you folks have been doing, the Malama Ohana Working Group. And
Right.
go ahead.
Okay, mahalo, Chair and Senators. I'm gonna jump right in because I know I have limited time. But I'm
Yes.
Venus Rossetti Medeiros, and I am with Halekipa. I am also one of the co-chairs of the Malama Ohana Working Group, along with Laurie Tochiki, who couldn't make it today. The Malama Ohana Working Group was created for the child welfare system in Hawaii. And it rests on the premise that the system, as it currently operates, perpetuates harm, inequity, and systemic failures that fail to adequately serve our children and families. Instead, a new model of care, grounded in prevention, community empowerment, and cultural responsiveness, can be developed to better address the needs of vulnerable families. Here are key points to support this argument. Okay. The Malama Ohana Working Group was established to seek authentic, relevant, and necessary transformation based on real relationships and partnerships. This unique process called for a community-centered vision. We relied on the voices and stories of those with lived experience. So it was a bottom-up approach and not a top-down approach of creating a vision for the future. The final report will be based on community conversations. Most of the stories we heard were painful, but hopeful at the same time. However, the biggest message we heard is that caring for our children and families must be a shared kuleana. Our report concludes that the system is failing, but it also concludes that we can be hopeful because the strength of our culture, our history, and values in Hawaii. We did not water down any of the recommendations, even if some of them seem unreachable. The time for compromise will come later during implementation. I want to express what the report is not. It's not a legal, economic, or quantitative analysis. It is not a platform for state government or other stakeholders who do not have lived experience to propose reforms. It is not a statement about what is easy or expedient. It does not compromise the hopes and dreams expressed by our children and families. It does not compromise any of the recommendations that was shared by our families across the state. The stories that we heard and the ideas that were shared move towards the relationships, practices, and mindset changes that are needed. We also found that there was no trust, that there is a need for strong leadership who can deliver innovative implementation and manage staff accountability. The biggest mindset change is that we must make a commitment to our children and families. We cannot rely on making excuses. We gotta do better. And in order to fulfill that commitment, we have to work together with a shared vision. Some of the systemic failures and harmful outcomes that is gonna show up in the report is that there's a disproportionate impacts on Native Hawaiians. The child welfare system in Hawaii disproportionately impacts Native Hawaiian children and families, perpetuating historical injustices rooted in colonization and systemic racism. This overrepresentation reflects a failure to address root causes such as poverty, housing instability, and historical trauma. Trauma from family separation. Removing children from their families often causes long-term emotional and long-term psychological harm, compounding the very issues the system aims to address. Foster care placements frequently lead to instability, disruptions in cultural identity, and diminished well-being. Inadequate support for families. The system focuses heavily on punitive measures rather than providing families with the support they need to address challenges like substance abuse, domestic violence, mental health issues, or economic hardships. Secondly, is misaligned priorities. Punishment over prevention. The child welfare system often intervenes after crises occur rather than investing in preventative measures that strengthen families and communities. This reactive approach fails to address the root causes of neglect and abuse. Resource misallocation. Funds spent on foster care and administrative bureaucracy could be redirected towards community-based services such as housing support, mental health care, and culturally appropriate parenting programs. Thirdly, cultural disconnect. Erasure of Ohana values. Hawaii child welfare system often undermines the traditional Hawaiian concept of Ohana, which emphasizes collective responsibility and care within extended families and communities. The system's focus on individualistic Western modes or models of intervention is a poor fit for Hawaii's cultural values. Disconnection from community resources. The current system fails to fully leverage the systems of local communities, nonprofits, or community-based organizations, and cultural practitioners who are better equipped to provide holistic and culturally responsive care. And fourthly, ineffectiveness in protecting children. Foster care challenges. Children in foster care often face high rates of abuse, neglect, and instability, with many experiencing worse outcomes than their peers in terms of education, employment, and mental health. And failure to address root causes. By focusing on individual cases of abuse or neglect, the system neglects systemic changes and issues such as housing insecurity, generational trauma, and lack of access to mental health care. An alternative vision, transformative care. I'm sorry, my tongue is all twisted. Transformative care. Rather than continuing with an ineffective and harmful system, Hawaii should replace the child welfare system with a trauma-informed, culturally grounded, and prevention-focused network of care. This new model would include investing in prevention, redirect funds towards addressing systemic issues like poverty, affordable housing, and accessible health care. Strengthening communities, empower communities to take a leading role in supporting families, leveraging cultural practices and traditions. Supporting families holistically, provide comprehensive services to families in crisis, such as parenting support, counseling, and economic assistance to keep children safely at home. So rather than taking a child out of a home because of poverty-stemmed issues, why not give the money that you would spend on foster care to give to the family to help meet that need in their home, rather than giving it to a resource caregiver? Transforming the child welfare system in Hawaii is not about leaving children unprotected. It's about building a better system that prioritizes prevention, family preservation, and cultural integrity. And by investing in community-led solutions and dismantling the harmful structures of the current system, Hawaii can create a model of care that truly honors and values aloha, kuleana, and ohana while addressing the root causes of harm.
Okay.
So, some of the main recommendations is prioritizing family support services with mandatory supporting rather than mandatory reporting, and community-based places of help, which is the protective factors around child abuse and neglect. Secondly, accountability, transparency, funding, staffing, have a accountable workforce that is well-trained, staffed, and compensated. Thirdly, trauma-informed culture and training throughout the child welfare system using the trauma-informed care principles. Fourthly, trauma-responsive services such as the most difficult issues such as domestic violence, mental health issues, substance abuse disorder, and severe poverty. And fifthly, acknowledge historical and present conditions, strengthen Hawaiian values and culture in the system through a Native Hawaiian perspective. So mahalo. Any questions?
Okay. We're going to have Tia Hartsock speak next, but thank you. But be around for questions. Thank you, Venus.
All right, you're welcome.
Aloha, Chair, members of the Information Briefing Committee. Tia Hartsock, Office of Wellness and Resilience, here with Keala Kapawiki Santos with our office as our project manager on this specific Malama Ohana working group. We wanted to share about, as you've heard some of those recommendations from this forthcoming report to the legislature from the year long of this working group. We were tasked, let me back up a second. We were tasked specifically with legislative action last year to run this Malama Ohana working group. And in coordination with the two co-chairs, we're able to be a part of this learning process over the last 14 months. Through these recommendations, we tried to distill as much as we could to see how we would be able to support the ongoing implementation of some of these recommendations. And what our office decided and have been through many discussions, not only with the chairs, the co-chairs, the Malama Ohana working group, and within our staff to determine what would be best for us to address and do our part in some of the implementation pieces of this. We looked at, in terms of our mandate, also in terms of the executive order that came out from Governor Green in February of 2024 to create a trauma-informed state. We decided that looking at partnering with child welfare services to offer trainings, like a year-long type of learning collaborative trainings with their entire staff. These types of trainings aren't just kind of a one and done type of training, but it's more looking at systemic change over time. It would be quite the engagement with the staff. There are some best practice tools and toolkits across the child welfare field that have been developed and vetted to kind of inform these pieces. One is a trauma-informed organizational assessment that was developed and vetted through National Child Traumatic Stress Network, specifically for child welfare systems. There's also many tools that have been specifically developed for child welfare systems that look on how to do transformation and how to implement trauma-informed care principles with staff across the department. So one of the things that we're looking at doing is, and proposing, is to engage in this year-long to 18-month process of an entire organizational implementation of creating trauma-informed trauma-informed staff so that they can both approach and respond to families. The other part of that that's not mentioned in here is, but we've heard in some of the Malama Ohana meetings, is the need to be able to provide this education further in the community as well. And so looking into that concept. The other piece that we're looking at, so as you could see from the co-chair Venus's recommendations, those 5 major buckets of recommendations, the other one that we're looking at is piloting a program. It's more of the prevention side. So really looking to see how our office can look at assisting in the prevention so that people either don't enter or don't re-enter the child welfare system. And so we did quite a bit of homework to see what type of program this would look like without requiring and requesting legislative funds. So we have found that there are TANF reserve funds that we would have access to that would be very appropriate for this type of pilot to pay for and complete, an ability to create this pilot project around identifying families with specific criteria at high risk of entering the child welfare system or re-engaging, having to re-engage with the child welfare system because of other risk factors that are that would be present in the families. So we're looking at right now this program being about 50 to 100 families, looking at specific criteria for entry into the families, and looking at the ability for us to make sure that any type of TANF use is appropriate, but really looking at peer support navigators to be able to connect families at risk with appropriate government assistance programs that they might not already be tapping into or applying for. Part of that also is looking at connecting families to parenting classes and cultural programming that they might not be connected to. So of course we would not want to duplicate what families are already receiving, but look for the families who are not kind of slipping through cracks, if you will, or not being identified in the system yet, but at risk to be. Did you want to add anything to that?
I think a big piece of this would be around hiring peer support navigators, so those with lived experience to work alongside the families. And they're, according to our conversations with TANF, we are able to utilize TANF reserve funds to do this piece. And then the other piece is accessing short-term financial assistance. So there's a really fine balance with TANF reserves and those families that already qualify for TANF. We don't want to make them ineligible for certain assistance, but there are short-term pieces that we can help with, concrete supports around transportation, basic needs, hygiene, diapers, those types of things. And so that's where those extra reserve dollars would come into play.
It's really looking at the TANF workforce development kind of aspect of the eligibility of those funds. The other piece and how it really ties to this concept is thinking about, if we really dive into and look at the root causes, if we think about some of the root causes that create abuse and neglect in situations, is really looking at overwhelm, trauma, untreated trauma or unaddressed traumatic experiences, the overwhelm of economics, the insecurity of financial stability, looking at multiple jobs that people have to hold. So how do we try and assist and better support families so that they are not severely impacted by some of those limitations, both economically as well as through social service supports.
Okay, thank you very much. Questions, members? None? Okay, I have some questions. So, Venus, are you there? So
Yes, I am.
Okay, one of your recommendations is an ombudsman. Have you folks figured out where the ombudsman is going to be placed? Is that going to be in the Office of Ombudsman? Is it going to be in the Office of Wellness and Resiliency or under DHS? And do you folks have any figures as to how much this is going to cost?
You know, we've been exploring different options, been talking primarily with Director Tia Hartzop to try and figure out where this could fit, whether it's in their office or we're thinking probably not in DHS office, but we're not sure. We are currently still working on that, Senator, as far as how that would look like. And so
Okay.
I can't give you any concrete
Okay,
figures.
I'll ask Tia. So what did you come up with?
I think it would be appropriate to add a CWS specific person to the Office of the Ombudsman. There's already a structure in place. There's already procedures and policies there. They've already got that structure. So that would be our recommendation.
Okay. Any follow-up? Okay.
Just very quickly.
Okay, go ahead.
Have you talked to
Rep. Martin.
the office to see if they would welcome that?
Not yet.
Okay, thank you.
Okay. So I have more questions.
Go ahead.
Okay, regarding, basically, it sounds like this trauma-informed care need for helping out, I guess, Alice families so that helping out poverty will reduce abuse and neglect. And I think most abuse is, that go into the system is in fact neglect. Those who are unable to find childcare, working two or three jobs at a time. The question is the immediate needs, right? Do you folks have any potential solutions? Because that's what happens to CWS. It's what
Yeah.
all of you folks' solution, it's gonna take a while. Probably take more than the 2 years that Daisy Hartsfield is saying to monitor the licensing. What about the immediate needs? Have you folks looked at the auditor's report?
We could immediately.
Okay, Venus,
sorry,
you first.
So, one of the things that we're trying to look at is, basically majority of the families who are being recommended to CWS, many of the issues are surrounding or connected to poverty issues, right? It's the lack of. And so one of the things that, back, if you guys who have been around for a long time, when Blueprint for Change was created and that whole diversion, right, system of care was created, they had a mechanism where people would be, given to the neighborhood places, and they would have like a place where the families could go and get those kinds of supports taken care of, so they wouldn't enter the system. And so we're kind of coining this this place as a capico, like giving support to organizations who could work with the families prior to even entering child welfare, so that could happen, right? And their needs could be met that way. And many of the family resource centers right now could use more funding to be able to do stuff like that. And we could redirect some of the funding, like Tia is talking about, to go towards immediate concrete supports and needs for the families.
Okay, thank you, Venus. Tia, you had.
I was just going to say, if we look at piloting this program, hiring people that have lived experience in the child welfare systems, either as previous youth involved or resource caregivers that have been involved, or even birth parents that have been involved, to be able to utilize their lived expertise to be able to help inform the way in which families are able to either navigate through the current system and or maybe access further supports or access what we call natural supports in the communities, so that they don't feel so kind of alienated from us or lost in a system prior to even getting there. If we're looking at this pilot project and utilizing the current programs that are existing, that would be, and it could be an immediate piece.
Okay. Any further questions? I know DHS is chomping at the bit to respond. So,
I have one question.
okay, go ahead.
So when you talked about challenges that should be addressed instead of removing children, and you included in that domestic violence and substance abuse, that really concerned me. I feel like children are removed now, and the birth parents are very, very highly encouraged to solve those problems with support from the state and Epic Ohana and other programs, so that they can get their kids back. But are you suggesting we leave the kids in the house no matter what?
So one of the, just, so once again, the recommendations are based on stories that was coming from people with lived experience, right? So some of the mothers came out to share that when they went to file for a restraining order, immediately CWS was alerted and the children were removed from their home. And here they are trying to protect their children, you know, to be in an unhealthy environment, and their children were removed, and these mothers were devastated. And so a couple things happened. People don't want to report domestic violence anymore in fear of their children being taken. So these women are not reporting. And secondly, years go by and they cannot reconnect with their children. So these stories are like, once again, is what's helping us to come up with these recommendations. So why are we allowing CWS, okay, that's the system, I'm talking about the system, to be able to take children out of home when there is at least one safe parent. Children should be able to remain with that one safe parent. You know, and understanding the whole dynamics around domestic violence, you know, is really important for a caseworker to understand. Because a mother doesn't report domestic violence right away doesn't mean that she doesn't love her child. Doesn't mean that she's not able to care for her child. So that's what I'm talking about when we're talking about domestic violence and substance abuse. If there is one healthy and one caring adult in the home, then the child should be able to stay with that parent.
Okay. Okay, you have any follow-up, Tia? No?
I think I just wanted to respond to what you were saying about actionable items. So there are over 100 recommendations coming out. So our office wanted to see what we might be able to act on immediately. And so these are just some of the immediate recommendations that could be implemented in the next year. We will continue to sift through the recommendations and look at what else we can submit legislatively and what we can implement just within, you know, our partnerships with DHS. So I think one piece with the trauma-informed care training, you know, a big issue right now is workforce shortage within CWS. So if we are implementing those trainings, you're creating an environment where that folks want to be and want to work when they feel empowered, when they feel safe. I think that'll help with some of the recruitment and retention that we're hoping to see there as well. So,
Okay.
yeah, thank you.
Okay, any follow-up?
Senator,
Yes, Venus.
I do want to mention that for the licensing, one of your questions was, you know, Catholic Charities came forward, and then now CWS doesn't have any contractor. We are really challenged right now in our community-based organizations to get insurance. There's no insurance provider that wants to insure us, and that's why no one's coming forward. I just wanted to let you know that it's been a challenge. We're trying to address this with DOH and DHS. What are they gonna do to help community-based organizations to be able to apply for these kinds of contracts when no one wants to insure us?
Okay, thank you very much. And we have the Chair of Commerce and Consumer Affairs here, whose insurance is one of his big issues. So thank you very much. I want DHS to come up. Thank you. So you've heard the. Before you do your presentation, we have questions. Okay, and people who know me know I used to be a family law attorney, and I used to represent CPS. I used to be a GAL. So I also represented those who filed for protective orders and defended those who have filed for protective orders. So I know boots on the ground, at least in Third Circuit Court in Hilo, what's happening until I became a legislator. So I do know that that's why I understand social workers have a difficult time because there is already a mandate in the statute that requires you folks to try to keep families together. However, we hear from Malama Ohana that, and I do know because I used to do family law, that there are social workers who maybe because they're not trained with trauma-informed care, those who do a knee-jerk reaction that they feel that it's because they're overworked, that it's safer to remove a child rather than do the hard work in helping the family. So I understand where the people from Malama Ohana come from. So my question is, okay, I'm getting to that. One, do you folks have the resources available? And if not, is it gonna be part of your budget request to have the resources available to help those families who are challenged to get their act together before removing the child?
So you're asking how do we have any budget to give for additional programs or resources for the community families
Right.
for services like wellness related?
Yes.
Okay, so I do not have that in our budget,
Okay.
and we have
And-
not requested it at this time.
Okay.
So-
So prior to the start of the session, will you be able to come up with figures for us so that we may be able to, you got chairs on both sides here on House and Senate, so that we may be able to ask for it in potential bills?
So we are, yes, so yeah, to answer your question, yes, we will be working with Tia them on discussing it. The question has come up during this in regards to the recommendations is where should it be housed, right? Right now, Child Protective Services, our basic charge is for child safety, right? But if this is more like a wellness issue regarding supportive services, is Child Welfare Service the best place for it? Or is that should be placed in another department in which they focus on, let's say, mental health? Or, again, we are in discussions, we are looking at that. I do not have the figures for you. All I can tell you is that, our frontline staff in CWS, because I visit them on most of the islands, they're committed to working with these families, right? And they're charged with a very specific and stressful balance between meeting with the child, assessing their safety, right, and investigating the current situation to ensure that they are safe. So it's not an easy task at times. We are short-staffed. That's one of our issues. We have talked about training and continuing to support our staffs. But when you talk to them, even though they're overwhelmed and to me somewhat traumatized, they always bring up as a priority that they want more community resources. And unfortunately, we are working with our community partners, but they're facing this very similar challenges: the lack of trained labor force, the lack of. We are aware of the insurance thing we have met, but there's other challenges as well besides just labor. So, to answer your question, we are willing to work. I know. Not only both chambers have asked us to come up with ideas, and they're willing to champion. The First Lady, this is very close to her heart. She has challenged us directly to, find other ways and what would it take, and can we help our keiki. And our governor has said he doesn't want to hear excuses for barriers. So we are doing what we can on the executive level to address those.
Okay, and you've heard from Tia Hartsock that they are going to be able to leverage TANF funds to help do this support.
We are currently working with them. We have our
Okay.
TANF people looking at that. Again, we have different federal, so we are looking at that. We believe that there is ability to support. So we're trying to figure that out and what funds and how that would be implemented.
And really from the first Trump administration and now that he's back in, we have Family First monies. Could you folks, that's what I'm segueing into, because Family First concept is to try to keep the families together by giving them supports. Have you folks?
We have that in our presentation.
Okay.
Yeah, and if I could kind of piggyback on what Venus had shared and Tia in regards to Malama Ohana, one benefit we got from participating in that work group is the recognition of child welfare as a system, not necessarily as child welfare, the agency. That child wellness is the whole system, which is more than just child welfare services, which focuses on the safety. And we've come together as a community now where we can reach out and say, hey, look, what's some ways we can come up with the funding? And it's easier now to have those discussions with other departments than prior. So that has been a benefit of the Malama Ohana work group, and I just wanted to recognize that.
Okay, do you folks have any questions regarding Malama Ohana, Office of Wellness? Okay, Representative Martin.
So do you think that you folks, because I know Tia's concept of using the TANF reserves for this pilot, it's a very small pilot, probably in one location, I would assume. Would you be able to replicate it on other islands? Is that something that the department might be able to do?
We're open. Again, we're at the discussion stages on what parameters, how that would look like, what that would entail. Is it going to be contracted? Is it in-house? Is it, if it's with another department? There's a little bit avenues, but we are open to work with them, talk with them, and support their endeavors.
Okay. Okay.
And-
Any other questions? Okay, go ahead with your presentation.
Can you put up our presentation real quick? Okay, thank you. Okay, by the way, as I begin, I'll introduce myself. I'm Ryan Yamane. The view looks different from here. The last time I was here, I was in conference arguing. So just want you to know, I appreciate the time. To be very quick, what we did is I met with Child Welfare Services. This has been an ongoing issue. I'm here with Daisy Hartsfield, our administrator. We will be going over what we're doing as a department and then specifically under child welfare. Okay, so these are some of the major priorities. We want you to know we are tasked with keeping our keiki safe. That's our priority, that's our goal, that's our mission for our workers. We want to, again, preserve the Ohana unit. We do engage and we love our partners. We want resiliency, not only within the families that we serve, but also with our staff and our partners. And then, we appreciate and we want to continue to support our Hawaiian culture and values. Okay, moving forward, just want you to know, we did a planning session. I put it into 3 action items as our top priorities going into this legislative session. First is we're putting hiring and retention. Second would be training. And then the third would be updating our policies and procedures. And I'll briefly go through all 3. Okay? So first, we have identified that in our area of child welfare services, we have over a 30% vacancy rate. We want to address that. We are currently working actively with our HR, with the Department of Human Resources Development. They've done a multiple on-site interviewing job fairs. I've attended the ones in Chair Martin's district as well, and Chair Keokulole's district up at Windward Community College, but we've also had it at Leeward Community College in Senator Aquino's district, or near his district. Let you know, we are looking at various issues to work on it currently to address needs now. We are seeking in our budget shortage differentials for child welfare staff. We're also implementing immediately, as well as asking for some support to increase the safety for staffs and visitors that visit the site, our units. And we want to promote additional training and support for staffs to not only increase their knowledge, but also to allow them to feel safe and protected. Okay, so regarding staff training, we are working with entities like our Attorney General's office to develop trainings to update our staffs on the laws, the implementations. That is projected to hopefully begin next month, and we're looking at doing it annually with all staff, as well as we currently have staff training for new hires, right? Just to let you know, we also are looking at other trainings that we can implement that would promote cultural sensitivity, cultural awareness, as well as looking at national best practices and our ability for our workers to work with our partners in the judiciary. Okay. And the last area we've been also addressing currently is in response as well to the auditor's report, as well as in our partnership with the Attorney General's office. We are looking at currently groups to not only review our rules, but also update our policies and procedures to make sure that not only updated, but they're appropriate to the times, okay? Just quickly, I'll go through each area, but I want you to know we develop a timeline for objectives for 6 months, 1 year, and 2 years. Okay, so I'll go through. The next one is on 6 months. These are, next slide, please. Okay, so 6 months objectives. We are looking at differentials. We believe that this would help assist not only retaining those within our department, but also bring in hopefully more clinical staffs to address our vacancies. We are looking at other measures and partnering with the Department of Human Resources to do a variety of things. Even we currently are exploring the new system that was developed by DHER, the HOLO program. We have also explored and about looking at temporarily contracting out clerical staff if needed. We haven't pulled the trigger on that, but we are looking at that in regards to so we can free up our clinical staff to be able to do the direct contact work. We are coming up with a schedule to look at updating our policies and procedures. Our 1 year mark, the goal for hiring within the division and within our HR is to hire at least 50 new clinical workers, as well as address any retirees or vacancies that erupt in child welfare. So we have a plus 15. We're doing this with a number of issues regarding working with HR, and we've implemented some of those measures immediately. We also are looking at how to use current existing funds to procure potential training, curriculum development, and training deliveries, okay? And the goal within 1 year mark would be that we not only have reviewed and processed rule updates, but also at least try to reach at least 10% of all of our policies and procedures be reviewed and modified if necessary, okay? Now, 2 years from now, the reason why I picked 2 year mark is then we will be going back into the next biennium budget. One, we hopefully could come to you and say that we've reduced our vacancies to below 20% for child welfare. That means we would reduce it by over 10%. We want to have for you efforts that are sustainable regarding recruitment and retention. We want ongoing trainings to be virtual and easy accessible to our staffs. And we would have at least half of all of our policies and procedures and to be updated and legally appropriate. Okay? Now I'll turn it over to Daisy.
Thank you. Chair, I'm going to be discussing the internal corrective action plan that child welfare is moving forward with, and we anticipate that this is going to be a plan in progress for the next up to 2 to 4 years. Currently, we are working with the Office of the Attorney Generals. We actually have deputies assigned that are working with us directly to review all of our administrative rules, our policies and procedures, as well as the current federal guidelines, so that we can get them all aligned and make all the appropriate amendments so that everything is consistent and it's clear. And we believe that we should be able to do that within the next year or two. We're looking at possibly either contracting out or using vacant 89-day hires in vacant positions to get additional staff to assist with this task, because currently we do have capacity issues, and so we want to do this as quickly as possible, so we'll need additional supports. And then in the next 2 to 4 years, and again, it's specific just to the licensing, we're hoping that we'll have those policies, rules, statutes amended, and then again, we'll have to train our staff so that everybody is aware about the policies and procedures, and so that it's applied consistently statewide. Specific to contract monitoring and evaluation, that is not with the branch, that's with another office, that's with our staff support office. Again, in the next year or 2, same thing, working with the Department of the Attorney Generals, again, to look at how we can improve how we monitor our contracts, make sure our contracts are written more clearly and more specifically and meet the requirements, so that we can ensure that contracted provider is indeed providing the services they've been contracted for. And similarly, years 2 to 4, once we get the goals of years 1 and 2 accomplished, then it's a matter of just formalizing it, having it in writing, providing notices of the current rules, statutes, policies and procedures, and then training staff. And then in regards to management, we believe that within the next 2 years, we will have all of our management on board in regards to what the expectation is in regards to meeting current policies in terms of licensing as well as monitoring of contracts. So that in a nutshell is the corrective action plan in response to the audit that was completed. I also wanted to share next slide, which is about our Family First, because that has been mentioned. So I have the most recent information that was provided in a newsletter, and it does indicate that within the past 20 years, this is actually the lowest number of children that we've had in care. And so that's of significance. But we can't attribute it just to Family First alone. It's part also because of the shift that the practice has made in terms of trying to strengthening the families to maintain children in their home instead of, moving to foster care as a response. The next slide. So some of the services that is specific to this plan include home visiting and intensive home-based services. Hawaii was one of the first states in our region to get federal approval to move forward with our plan, as Chair knows. And so we've been slowly adding in the evidence-based services. And to date, we have served 241 families in regards to home visiting services, and we were able to maintain 68% of them in their family homes. And in terms of intensive home-based services, statewide, 126 children have been served, and we were able to maintain 52% of them in their family home. So I'm going to move on to areas of support that has been identified for our Child Welfare Services Agency. Recruitment and retention of staff, that is key. That's been identified by everyone who wants to improve the system, and nationally, that is a topic that is at the forefront. Without sufficient workforce, we cannot do the work that is required. And the National Partnership of Child Safety has also recognized that we need healthy workers so that they can make good decisions. When our workers are stressed or burnt out, they're not going to be as able to make as good decisions. So we need to be able to have a stable workforce and be able to identify their wellness needs so that children can remain as safe as possible. We do have a bill that we hope to introduce, and that would be to add protective service workers to the protective class related to the offense of assault in the second degree. In recent years, our staff has experienced more incidents of being threatened, physical harm, of families showing up at their residence, threatening them, showing up at family birthday parties, saying, basically, saying things that make our workers afraid for their own safety. We've had to ask for additional security assistance because of threats of bringing weapons to the buildings, and so we do also have an ask for some funding so that we can continue to add more panic buttons to the office, provide more security. We're looking into the cost of metal detectors, as well as apps that workers can put onto their phones so that they can receive immediate assistance if their own safety becomes of concern. To also assist with the ability to determine child safety, we are requesting the addition of nurses to our staff. We are finding that the cases in which children are taken into care are more severe than cases in the past, that there are significant needs of these children, not just medical, but they have behavioral needs that need to be met. They have mental health needs, and if we had nurses on staff, we would have that medical expertise accessible. They could go along with our workers to do investigations. And we already have nurses in our adult protective services branch that go along with investigations, but that's something we don't have in child welfare. And we believe if we had that type of resource, that we would be able to make better assessments as well. Vacancies, next, we have a chart, and I did make a distinction between our support staff and professional staff because the shortage differential that we did receive was only for our professional staff. But we rely so much on our support staff, and they also have a high vacancy rate as well. So in this budget ask, we did include those support staff positions as well. Despite some of the challenges, there are definite strengths of child welfare services. Nationally, child welfare leaders last 1.5 years. We've been fortunate where our administrative leaders have been in their positions for more than 4 years. Our relationships with our community partners have increased, and now we can reach out to community partners and use them as resources. The recognition of culture and cultural practices, we've included that in our new hire training. We require that of our new vendors so that they can become familiar with the families we work with and why we do things the way we do here in Hawaii versus in other states. We also have a very committed and dedicated staff, and I just want to also add that on a national level, Hawaii's had some recognition in terms of their efforts to maintain families either in the family homes or with Hanai care, as well as the efforts to recognize the significance of culture and how that impacts a child's wellness. I want to wrap up because we have encouraged people of lived experience to participate in making decisions related how to improve the system. We hear from parents who have been in the system. We hear from youth who have been in the system, but rarely do we hear from workers who actually work in the system. And I wanted to share a poem that was written by a child welfare worker, and it's powerful. And so I just wanted to read it so that you can know of this perspective and the challenges that our workers face. It's called The Weight of the Call. 2 decades deep in the trenches of pain, where hope feels fleeting and shadows remain. The cries of the broken, the faces I see, leave marks on my soul that will not let me be. I craft words for trials, sleepless and worn, a shield for the helpless, a heart that's torn. Burnout creeps in, stealing my light, leaving me numb in the darkness of nights. Secondary trauma, an invisible thief, stealing my joy, magnifying grief. Their nightmares echo, their pain I claim. In a role where my heart bears the blame. I remember my first removal. How could I forget? The screams of children, my heart heavy with regret, driving away with their cries in my ears. Behind me, the parents, helpless, drowning in tears. On July 3rd, at the Ohana conference table, I made a choice I believed was stable. I placed the newborn with family nearby, trusting in love, suppressing the why. But July 4th arrived with devastating news. A child's life lost, leaving no clues. I carry the weight, the unbearable blame, a decision that haunts, a scar with no name. As a supervisor, I shoulder much more. The pain of my staff, the wounds they ignore. I see their fatigue, their silent cries, and I try to stand strong, though my own spirit dies. Hair falls like leaves, stress takes its toll, my body a map of the wounds on my soul. Back pain whispers of financial strain, overworked, underpaid, it's a ruthless chain. Stomach tightens with emotional stress, a knot of anguish I cannot suppress. I feel it all, every ache, every crack, just to hear, it's part of the pack. Massagers bring solace, but healing feels far. The wounds of this work cut deep as a scar. Flashbacks and fears, hyper-vigilant days, lost in our suffering, caught in the maze. Fatigue overwhelms, illness takes its toll, my body weakens under this heavy role. Emotionally numb, I begin to withdraw, haunted by the pain and the trauma I saw. Why do I return again and again to a job that feels like a battle with pain? Why do I keep trying when it tears me apart, when it takes from my family, my soul, my heart? And again, I just wanted to share this as a voice for, oh, I'm sorry, I didn't finish. Why do I return again and again to a job that feels like a battle with pain? Why do I keep trying when it tears me apart, when it takes from my family, my soul, my heart? Perhaps it's the hope, fragile yet real, that one life saved is a wound I can heal. Perhaps it's the calling, too loud to ignore. Intakes keep coming, there's always one more. I fear this job more than the weight of my name, yet I shoulder it still, for it's not just a game. The burden I carry, though heavy, is clear. The fight for the voiceless, to hold them near. 2 decades of stories, a lifetime of scars, a journey that takes me so very far. Though trauma consumes, though I stumble and fall, I rise every day to the weight of this call. And again, this is a voice from our workers, and I think this is a voice that all of us share in wanting to protect our children and keep them safe. So I just ask that you carry this with you as we all do our best to try and care for our most vulnerable in our community. Mahalo.
Okay, thank you very much.
Thank you.
Okay, anything else to your presentation?
No, go right ahead,
Okay,
Chair.
good. We only have 10 minutes left. Any questions? Okay. We fully know the kind of stressors that the social workers bear. And it's, in fact, I brought this up with Director Yamane, that I withheld informational briefings despite Isabella Kalua, Ariel Sellers, despite the public wanting a head on a plate, because like I said, I was a family law attorney. I'm fully aware, especially when the social workers are under stress with the weight of a death on their hands and being underpaid. That's the reason why we keep throwing money. We had the 2017, it was not a request by DHS. It was House of Representatives, mine and Chris Todd's bill that increased the East Hawaii pilot program. When we threw the $10 million in, it was not a DHS request when we threw in the Malama Ohana, because we know that you folks are already understaffed. But we need you folks to tell us what you need. We cannot just come up with some money in the air, like the $10 million and the additional 10 positions, when we don't have the boots on the ground. And that's the reason for this informational briefing. It isn't to place blame. We are asking you to help us help you. Okay? And I want to make sure you know that.
We are aware.
Okay?
Thank you. We
Because
appreciate it.
one of the things that was brought up to me was that this $10 million was a one-time funding. We need you folks to tell us how much you folks need to keep going. Because when I heard that the $10 million was a one-time funding, which we know it was, because it was a shot in the dark, we didn't know how much you folks needed. We just, Sylvia Luke, when she was finance director, finance chair, came up with the money. It was just a shot in the dark. But because it was one-time funding, we didn't know. I heard that DHERD couldn't place the salaries on board. So we couldn't tell prospective, help you folks recruit social workers to tell them that this is going to be your ongoing salary. So you guys got to let us know.
Okay.
Okay?
Will do.
Maybe we need a resolution that DHERD needs to make this a priority, because even after the 2017, we have the chair of labor here, to make this a priority, because even after we added in the positions for the East Hawaii project, you folks couldn't even recruit. I got a phone call from a family, the administrative judge of the Third Circuit, saying that I hear that West Hawaii is fully staffed, but apparently from what the family court administrative judge is telling me, well, it sounds like it's fully staffed, but in reality, they're not actually filing petitions. He gave me a draft of, which sort of mirrors what which the audit says, that maybe folks are papering this over by not filing petitions. And I don't know. I'm hoping the Family First program is actually helping out, like you said, Daisy. And that's the reason why we don't have as much petitions for removal. But we don't know unless you guys are fully staffed, right? And maybe folks need more than one social worker over in West Hawaii, especially where the population there is growing. Okay.
And that's one of our priorities.
Yes.
Thank you.
So, Daisy, Elodie, we know you folks have a heavy burden. We know that the foster parents, the resource caregivers, having to take care of abused kids is super need of support, because taking care of abused kids is super hard. They have behaviors that is beyond that of a normal kid. We know that. But we need you folks to tell us, okay? Any questions? I made my comments. Thank you, folks.
Thank you.
And I'm hoping to hear you folks' budget requests, the monies needed to maintain and increase the differential, because like I said, I've got letters from social workers that they are getting paid as much as only a beginning teacher, where they have far more stressors and a far more heavier workload, and maybe we need to increase their pay if we want to, but we're not gonna know unless you tell us, okay? So thank you very much.
Thank you.
And with that, we are adjourned. Thank you, folks.